I'm Dr. Sean Hashmi. Self Principle stands for sleep, exercise, love, and food. Remember, this is separate from my day to day job that I do. This is the nonprofit work that I do to make sure all of you guys have the latest and greatest in terms of how you can take care of your health. So today's topic is an interesting study that was literally just published a couple of days ago, and I want to make sure you get a chance to hear about it. We talked about these new weight loss drugs called GLP-1s or glucagon-like peptide 1, and we've talked about what the benefits are, what are the side effects, what are things you got to sort of be concerned about. Today, we want to talk about a very important side effect. We've touched on this before. There has been some data presented, but this latest study that's there is important. And I want to make sure that you get to hear it first on this channel so that you have an idea of what to think about as you're talking to your doctor about whether or not you should use these drugs. So GLP-1s, names like semaglutide, which brand names of things like Ozempic, Wegovy, have been all over the news. There's lots of stories about weight loss, people saying these are the best things ever. But every drug that comes out, there's always side effects. And because weight loss is so tricky that we have to be able to understand that anytime we affect one pathway, it's going to affect multiple pathways. So, what does that mean? When we're talking about the mechanisms, there's essentially three main categories on how these drugs work. The first one is they will act by slowing down food going through your stomach. We call that delayed gastric emptying. In some cases, we've talked about the side effect where people have had permanent blockages of their stomach. The second portion is they can act on the pancreas to release more insulin. They can also reduce insulin resistance at the cellular level. So that's another mechanism. And then the third mechanism is they can act on the brain to reduce that food hunger. And so a lot of people have this food noise where if you have two people, one who is suffering from this disease, obesity, and one who's not, if they both look at, let's say, it's a piece of dessert, chocolate cake, the person who has this disease, obesity, their brain will light up far more than the person who doesn't have this disease. So, this concept of food noise, where folks that are suffering from this disease, when they look at certain foods, their brains light up, their cravings go much more intense than the next person. So, what about this whole conversation today of this new study looking at suicidal risk? Well, let's step back a little bit. When in the past we talked about this, we also talked about the data that came out of FDA's adverse event reporting system. Now, if you remember, this is a little while ago that I had presented that data, and we talked about that fact that the agency had said in their preliminary evaluation that they had not found evidence that GLP-1 receptors would cause suicidal thoughts or people to take actions on it. But they couldn't rule out that a small risk may exist. The European Medicines Agencies, or EMA, said it also found no support of a causal, meaning A leads to B. In other words, these weight loss drugs cause patients to have suicidal thoughts. And this was based on their 9-month review. So there's a new study. This is in the JAMA Netw Open, just published on August 20th, so just yesterday. And what it's talking about is they did a disproportionality analysis. And they used the World Health Organization's database. And what they were looking for was to see if there was a suicidal thought signal with GLP-1 receptors, specifically semaglutide. So the first thing to understand is, well, what's this database? The WHO database, the World Health Organization database, is known as VICI base. It's actually the largest and most comprehensive pharmacological database that exists. And then the second part is, what the heck is a disproportionality analysis? Well, in very, very simple terms, what you want to understand is a disproportionality analysis. It's going to compare essentially an observed proportion of an adverse event. So in other words, it's looking at how much of an adverse event occurs for a specific drug in terms of what you expect and what you. So if you start to get far more adverse events than what you were expecting, that's a disproportionality signal. So once again, disproportionality analysis, it's a complicated word, but what it's saying is that what you are seeing is greater than what you were observing. That's it. So now that we understand this disproportionality analysis, let's get into what the heck this study is all about. So this is actually the first analysis looking at suicidal thoughts, specifically with semaglutide, using the World Health Organization's Vigi-based data. And what they did was a case control design. So remember, this is not a study where they randomize people, there's a placebo arm, none of that. This is just case control studies. And so the researchers, they looked at 107 unique cases of people who had suicidal thoughts or they actually hurt themselves in relationship to them being on semaglutide. And then they also looked at 162 cases that were seen with another GLP-1 drug called liraglutide or liraglutide. That goes under the name of things like Victoza or Saxenda. So remember, semaglutide goes by the names of Wegovy and Ozempic. Liraglutide goes by the name of Victoza and Saxenda. Now, in terms of the population they were looking at, the median age, which is the middle point, were around 48 for the semaglutide group, 47 for the liraglutide group. The majority of people using the agents were female. For the semaglutide group, about 55%, and for the liraglutide group, about 61%. Why is this important? Because even in the general population, you'll see there are more women who are using these than men are. So, what did they find? This is the part that's very important to understand. When we start to look at odds, the data was looking between 2000 and 2023. So there's a lot more usage now in 2024 than there was in 2023. And for the first couple of decades, not a whole lot. It's just the last few years that Ozempic, especially when it comes to weight loss, has really taken off. So what they found was that there was a 45% higher odds of suicidal ideation reports that came in compared to all the other drugs that are in the World Health Organization's database. So one more time, there's a 45% higher odds with semaglutide compared to all the other drugs that are in that database. Now, this is statistically significant, but when they look at things like liraglutide, which is Victoza, Saxenda, it's another GLP-1, can be used for weight loss. That was only about a 4% increase, and it was not statistically significant. So in other words, in this particular case, the risk is really being seen specifically with semaglutide. The other part to note about this is that when they started to look at other medications, specifically medications that lower blood sugar or that serve as weight loss drugs, what they found was that semaglutide's odds ratio were substantially higher. How much higher? When you start to look at metformin, the odds ratio ended up being about 286% higher odds ratio, with SGLT2 456% higher, with drugs like orlistat, which goes by the name Xenical, or over the counter, it's called Ally. It was about 324% higher. So as you're talking about these drugs, there's something very specific about drugs like Ozempic and Wegovy that are linked, not caused by, not causing, we can't say any of those statements, but that are linked to increasing the risk of suicide or suicidal thoughts. And this becomes more and more important as we talk about it. In this particular study that we're talking about, just published yesterday, there were 94 reports of suicidal ideation out of more than 30,000 total reports that were associated with semaglutide. So the total number is still a small number. Once again, the total number is not very large. So we don't blow this out of proportion, but when somebody is worried things like suicidal risk, that in itself is significant enough, it's substantial enough that you have to absolutely take it very, very seriously. So when you're talking about things like 94 out of 30,000, yeah, it's very, very small, but don't let that fool you. Then the other part of this, which is absolutely critical to understand, is when they started to look at individuals who happen to be on other medications, antidepressants or benzodiazepines with semaglutide, their odds ratios were substantially higher. Remember, we said it was 45% higher overall. But when they were on antidepressants, the odds ratios were 345% higher. With benzodiazepine was 307% higher. So the reason this matters is if you're somebody who's thinking about going on these drugs, please, please make sure that you see a qualified provider. Make sure that your doctor knows, has experience with obesity medications, understands not just how they will help you with weight loss, but far more importantly, what the heck are the side effects that you need to be worried about, especially if you have ever suffered from any sort of anxiety disorders, depression disorders, if you've ever had any thoughts of hurting yourself, hurting anybody else, or any other mental risk factors that are there. And that's why, I see online there are all these websites popping up left and right where you can literally log on, pay, I think it's $100 or $200 a month, and they're compounded pharmacies and they're giving out these drugs like candy. And what patients are not understanding is that how much risk you are really putting yourself into. So this concept of compound pharmacies or off-label use, just make sure that you are working with a qualified professional. As you know, I don't have any stake in this whatsoever, but my goal is very simple. It's always been to make sure you understand the risks and you understand the benefits. Now, we've talked about some other side effects. We've talked about things like Ozempic face, simply because of the fact that as you start to lose weight, you start to lose it from outside first. That's why you'll see it in the face first before you see it in the belly and hips. But more important than that is other side effects are things like depression and suicide we're talking about, nausea, vomiting, diarrhea we're talking about, pancreatitis we're talking about. On the benefit side, we have talked about the SELECT trial showing that those who have suffered from a major adverse cardiovascular event, things like a heart attack, they're actually recommended to be on semaglutide. If they're looking at things like kidney disease, we talked about the FLOW trial, where it showed that adding on Ozempic could actually improve the protein in the urine, delay the decline in kidney function. Now there's data around sleep apnea or obstructive sleep apnea, OSA, where once again, GLP-1, specifically semaglutide, can be very helpful. We've talked about the role in diabetes. They can be very helpful. Now there's data coming out that's talking about Alzheimer's, dementia. Here's the question that I want all of you to remember as you start to see all the benefits. The first question is are you seeing these benefits with all these other conditions because of the fact that patients are losing weight? So in other words, if you lost weight, you reduce your risk of cancer, you reduce your risk of kidney disease, diabetes, obstructive sleep apnea. Is that the reason? Or is it because there's something so unique about using these drugs that when you're on them, you're going to end up finding that just because you're using these drugs, that's what causes the benefit? And the reason that matters is if it turns out that it's just a matter of weight loss, then we have so many options we can use. And if that's what it is, then what you want to understand is if you haven't fixed the underlying cause, if you haven't focused on trying to be healthier, trying to change your environment, trying to get a circle of friends who support you, who are in line with you, The lesson that I always tell my daughters, as you know, they're 7 and 11, they like to do jujitsu and wrestling. And I talk about them all the time. The thing that I always tell them is if you go into a room with 4 Olympic athletes, you're going to be number 5. Even if you are the worst of the best, when you step out, you're going to be better than 99% of the people out there. So the company you keep will either build you up or constantly try to break you down. So as you think about all of these things, keep in mind that when we talk about all of this stuff, we still emphasize lifestyle. Self, the concept of self is still sleep. You got to get more than 7 hours of sleep. The sweet spot is 7 to 9 hours. There's lots of strategies we've gone over. Exercise, not only do you need to do cardiovascular, you need to do resistance training. You got to lift weights and you got to do it at least 3 times a week. I don't care who you are. If you are young, if you're old, does not matter. I'm 49 and my kids are young, and all 3 of us, my daughters and I, we go to the gym every morning, and then in the evening we go and do jujitsu or wrestling. They do wrestling. I can't do wrestling. I try to do jujitsu, but you can see I'm constantly getting one injury after another. This was after getting beaten up by, I think the kid was 17 years old. But it's a humbling experience. I still do it because I like the fact that I'm getting better. But you got to move and you got to lift weights. And for food, once again, the data keeps coming out that supports this concept of eating more whole foods. Shift towards more whole foods, you'll do better. Now, you don't have to go 100%. If that's something that's not part of your culture, part of your beliefs, if it's not an environmental thing that you're going for, whatever it is, something is better than nothing. And 80% is way better than 0%. So a lot of people think if I'm not 100, I got to quit. But between 0 and 100, there are 99 other numbers. Pick one and go for that. So I hope you guys enjoyed this. Let's go and answer all the questions you might have. So if you got any questions about this topic or any other, please pop those in the chat area, and then let's go through them. All right. And Holly said, hi, Holly. Nice to see you again. Let's see. Joshua said, there are way too many people taking Ozempic. It looks unnatural. Go outside and walk. So, Joshua, this is an interesting point because a lot of folks are looking for a way to be able to get help to start that journey. And I think if we as doctors and providers and family members, if we were to start to encourage our patients, our siblings, our parents, our children to be just a little bit better, it would go so much further. When you look at all the fast food and processed foods out there, the entire industry has figured out how the heck to do better marketing. We're the only ones who haven't quite gotten there. We haven't gotten the message that we can make healthy food sound exciting by how we market it. We can make exercise sound exciting by how we market it. So the point as far as that goes. Syed, let's see, PX said, heard they might be prescribing it for sleep apnea now too. The answer is yes. And we still don't know if it's a cause. In other words, there's something specific about GLP-1s that's doing it, or is it just because of the fact that they're causing so much weight loss? And the next comment I see was, without lifestyle change, this is unsustainable. 100% yes. Remember some of the data that we talked about where if you looked at 12 to 18 months, the failure rate with GLP-1s was 60 to 80%. Whether people were quitting because they had side effects, because they just weren't seeing the results they wanted, it's a lot of stuff. And people will quit for all sorts of different reasons. So if you're somebody like that and you're thinking about it, make sure that you got the foundation for lifestyle down before you start to jump into this. All right, let me check to see if there's any other questions. No. So it looks like I covered all the questions for you guys for tonight. I want to once again thank you guys so much for joining. I know you guys are busy. If there's topics you're interested in, just leave them in the comments. I'll be sure to find studies on them. I'm always looking to see what's the latest and greatest study for you. And then, as always, I just want to leave you with one message. If there's one thing you can do in life, just be kind. It's the same thing I preach to my daughters. It's not a line that I use. I practice it myself. You can ask my daughters, the three of us, we always have this goal when we're together, is to just do a random act of kindness. So with that, thank you so much. Take care, stay blessed. Make sure you move, make sure you exercise. More importantly, make sure you lift. And as always,